Hello everyone, I'm Samar Younes, Clinical Assistant Professor at the Lebanese International University. I will be discussing a study I have conducted with my co-authors, Professor Mohammed Rahal and Dr. Nisreen Murad, under the title of Awareness and Knowledge of Chronic Kidney Disease among the Lebanese Community, a Cross-sectional Study. The authors have nothing to disclose related to this presentation or event. I will start my presentation with an overview of chronic kidney disease. As a definition of CKD, it's defined by the presence of decreased kidney function or kidney damage for 3 or more months, irrespective of the cause. The persistence of the damage or decreased function for at least 3 months is necessary to distinguish CKD from acute kidney damage. Decreased kidney function refers to decreased glomerular filtration rate, or GFR, which is usually estimated using serum creatinine and one of several available equations. As for kidney damage, it refers to pathologic abnormalities, whether established via kidney biopsy or imaging studies, or inferred from markers such as urinary sediment abnormalities or increased rates of urinary albumin excretion. As for staging of CKD, we have 5 stages. The purpose of such staging is to guide management, including stratification of risk for progression and complication of CKD. The last stage, which is stage 5, or known as end-stage renal disease, is a patient with a GFR of less than 15 or on dialysis. Moving to the risk factors of CKD, we have different risk factors, including susceptibility, initiation, progression factors, in addition to many other causes. Susceptibility factors can increase the risk, but they have not proven to have direct cause of CKD, including advanced age, dyslipidemia, systemic inflammation, in addition to many other factors. As for initiation factors, they include diabetes, hypertension, glomerulonephritis. We have progression factors and other causes. Moving to clinical presentation of CKD, early CKD has no symptoms. A person can lose up to 90% of his kidney function without any sign. However, once symptomatic, symptoms may include edema, increased blood pressure, fatigue, pruritus, nausea, loss of appetite, weight loss, dyspnea, anemia, oliguria, in addition to electrolyte abnormalities, microalbuminuria, elevation in serum creatinine B and homocysteine, abnormalities in urine analysis, and secondary hyperparathyroidism. What about the prevalence and mortality of CKD? In 2017, there were globally 697.5 million cases of CKD. The prevalence was estimated as 9.1% in the world's population. Also in 2017, CKD resulted in 1.2 million deaths and was the 12th leading cause of death worldwide. In addition, 7.6% of all cardiovascular disease deaths were attributed to impaired kidney function. Therefore, improving the public's knowledge about CKD and its risk factors is an important strategy for CKD prevention. Hence, the study was conducted with an aim of assessing the level of awareness and knowledge of the Lebanese population towards CKD in a community setting. What methods were used in our study? So this was a cross-sectional study. It was conducted among the Lebanese general population between July and September 2019. Adult patients are customers who were aged 18 years or more, presenting to community pharmacies, were included after explaining the study protocol and obtaining their informed consent. Afterwards, face-to-face interviews were performed by pharmacy interns in the professional study years of the Lebanese International University, who were realizing their pharmacy practice experience in community pharmacies across Lebanon. Data were collected by means of structured questionnaire. This questionnaire was reviewed and pre-tested by a group of pharmacy faculty members and then was finalized according to their comments. Finally, the study was approved by the Institutional Review Board of the School of Pharmacy and at the Lebanese International University. This questionnaire consisted of 2 main parts. The first section was composed of questions about demographic data, whereas the second question concerned about questions about knowledge and perception of CKD. Frequencies and percentages were used to represent categorical variables, and then data were coded, entered, and analyzed using SPSS version 22. What results were obtained? So a total of 1,308 respondents completed the questionnaire. Baseline characteristics of respondents are shown in Table 1. Their mean age was 37.15. The majority were within the age group of 18 to 30. Majority were females and Lebanese. As for the marital status, almost half were married. The majority, around 62%, completed their university level education. Majority were non-alcoholic and non-smoker. When asked about the last time the renal function was tested, it was found that 33.7% had never been tested for the renal function, and 16.7% don't even know or remember if they had the renal function tested or not. 17.2% had the renal function tested within the last 6 months, 9.9% within 6 to 12 months ago, 10.2% 1 to 2 years ago, and 12.4% more than 2 years ago. Moving to the participants' knowledge and perception of kidney disease, when they were asked about the function of the kidney, the majority knew that it makes urine, that it cleans the blood or filters waste from the blood, whereas only 13% knew that it can help in keeping the bones healthy, and only 45% knew that it can help in maintaining the blood pressure. As for determining the health of the kidney, the majority knew that a urine test can be used. However, only around 58% knew that blood test can be used, and only 23% knew that blood pressure monitoring can help in determining the kidney health. As for defining kidney disease, the majority knew that it's disease when the kidney stops working, and only 45% knew that we have 5 stages of chronic kidney disease. As for risk factors, majority knew hypertension, family history of CKD as risk factors, whereas only 57% knew diabetes, only 45% knew that heart disease, and around 42% knew that painkillers and obesity are also possible risk factors. When asked about the organs which can be affected in a patient with CKD, majority knew heart to be affected, whereas lungs, skin, and brain were only knew by minority of the respondents. When asked about the leading cause of death in a patient with CKD, almost 90% knew heart diseases to be the major cause of death. As for prevention of CKD, only around 50% knew that keeping blood sugar under control can help in prevention. Around 71% that controlling blood pressure can also help in prevention, and only almost half knew that keeping weight under control can also help in preventing CKD. As for treatment of CKD, only around 61% knew that drugs can be used for treatment, 78% knew that dialysis is a treatment option, and around 64% knew that transplantation is a treatment option. So in conclusion, the Lebanese general population's knowledge about CKD was unsatisfactory. Therefore, future efforts should be implemented on improving health education and awareness on CKD, its risk factors, and preventative strategies. Therefore, we need to raise awareness, we need to highlight the CKD burden, and encourage general public and governments to invest in measures for better prevention and early detection of CKD. Thank you.